Do you find that your orthostatic intolerance and POTS symptoms are worse in the mornings? Today I'm here with Amy and I'm Leanne from Active Health Clinic, and we're going to give you some tips to help your orthostatic intolerance and POTS tips in the morning. So typically symptoms of OI and POTS are worst in the morning because overnight we are typically laying flat in bed, horizontal, for a number of hours, 8 to 10 hours, and in that time we're usually not eating, drinking or moving. So then when we wake up in the morning and go from horizontal to standing, it's the largest postural change of the day, and that's the hardest part for our body to pump blood around and get that blood back up to our head and our heart. So what we can do to help get some of that blood pumping is, as we wake up, we can move our ankles up and down to start contracting the muscles in our calves, which is going to create a bit of a muscle pump. We can contract the muscles as well in our thighs and our glutes, so some of those larger muscle groups in the lower limbs, contracting and relaxing, which can help prevent orthostatic intolerance type symptoms by enhancing venous return. So this is helping to get the blood back up the body, back to our head and our heart. If we've been laying down doing some of those contractions, we can then come to a sitting position and pause, so slowly allowing the body to adapt to that more upright posture. While we're sitting, we might march the legs up and down or even just lift the heels a little bit while we're sitting there. Again, adjusting to a slightly more upright posture and getting those muscle pumps to pump the blood around the body.
That is very, very cool. So adding on to what Leanne was saying from like a food and diet point of view, when we're trying to get blood back to the heart and the head, we also want to get blood back to the gut. So our gastrointestinal tract needs blood too. And sometimes when there's not enough blood flow to our gut, it can make the mornings a bit difficult from a gut symptom point of view. So sometimes in the mornings you might feel nauseous or have stomach pains or feel a bit bloated. Some of those things can be blood flow related as well. So from a diet point of view, there's a few things we can do to sort of help to add to those muscle pumps and things like that. One of those is hydration. So trying to actually have about 500 mils of fluid before you actually make that change in position and get up and get out of bed can help increase that blood volume. And when our blood volume's increased, there is more blood to get to the head and the heart and the gut as well. So can be super helpful, and adding electrolytes into the water can be helpful for a few reasons. Because electrolytes have sodium in them, the sodium and the water together can help hold on to the fluid a bit more, so we're not just peeing it straight out. And the electrolytes also, for some people, help you drink a little bit more water if they taste good, and you find one that you like, can be pretty handy with that as well. Something else that can be good to help us when we're really not feeling well in the morning and breakfast is just the last thing that you feel like doing, which a lot of our patients will tell us. If we can try and actually calm down our nervous system or move into that more parasympathetic state by resting a bit, and resting, we can calm that down and make more of that blood flow, actually, instead of it going to our extremities and our muscles to like fight or flight, if we can get more of that blood flow to our gut to rest and digest, that can reduce some of those symptoms that you might be experiencing, like some of that stomach pain or nauseous feeling. So yeah, doing some sort of green time activity or resting for about 5 to 10 minutes before meals and about 10 to 30 minutes after. So that breakfast period can be really supportive for some people, which is cool. And then I guess if all else fails, which for some people it does, like you've done these things and you still feel like breakfast is really hard, one of the main things we say is something is better than nothing. So going for a breakfast that you might not think is the most nutritious option, having something is always better than not having anything at all. And going for something maybe like an up and go or a liquid nutrition can be handy as well, because sometimes that is easier for our bodies to digest too than having food. So yeah, hopefully you found that helpful. And yeah, if you have any questions, please have a look at some of our other videos in our social media or contact us. We'd love to hear from you.